job. Good job. I'm Sheriff Quadry. This is Nigeria Info, the nation's #1 for news, talk, and sports radio. Here in the heart of Lagos, Victor Island. Thank you for always staying tuned. Today, discussion on COVID-19 continues on the show this morning, looking at federal government barring China, US, UK as the Federal Ministry of Health announced 5 new cases of COVID-19 yesterday, bringing the total number confirmed cases in Nigeria to 8. Now, according to the NCDC on Twitter, and I quote, all 5 cases had a travel history to the UK and the US, end quote. We will be touching base with cervical cancer on the show today as well. We had a various and, as a matter of fact, strong conversation on cervical cancer last week, Friday, 14th of March, with Wamimo driving this show. Then we had Omolabake Fashogbon, female reporter, leadership program of the Wale Soyinka Center for Investigative Journalism on the show last week. Omolabake is the journalist with This Day newspaper. So today, I have in the studio a senior specialist resident in oncology, Lagos State University Teaching Hospital, Dr. Ajay Iben Adekpito, who will be shedding light on some other salient points, figures, and statistics on cervical cancer in Nigeria. So you have to stay tuned. Now, let's go back quickly to COVID-19. We have to start there. So just yesterday, we discussed updates on coronavirus on the show with our in-house Dr. Fred Unoigbohai on the backdrop of a Nigerian who was tested positive and confirmed by the NCDC on Tuesday 17th after returning from the United Kingdom about a week ago. That's on Friday 13th of March. A lot of arguments on the show yesterday, one of which is the fact that the index case of coronavirus, the Italian man, a caller raised the story about whether he has been released, from isolation and quarantine. We got confirmation yesterday from the Lagos State government, as a matter of fact, that this index case in Nigeria, in Lagos, is still under quarantine. That is the update right now. Dr. Fred said he wasn't aware of him being released. I said I wasn't aware of being released. A lot of callers called in and said, how can you say you're not aware? How can you say this? Well, we called after the show. We called the authority. We called the infectious disease hospital, IDH, here in Lagos. And we were told that the index case is still under quarantine. That has been settled. I love conversing with you. I love the argument. I love all the sides to be placed on the table. It just makes us work harder and make sure that we bring all the facts to you on the show. Also, yesterday we talked about why the federal government hasn't shut down, flights coming in from highly infected countries world over. But then again, it happened after the show. The federal government shut down, restricted flights coming in from highly infected countries across the world. 13 countries to be precise. So, you see, it's good to talk. When we talk, somebody is always listening. Now the Federal Ministry of Health has confirmed 5 new cases yesterday. The Center for Disease Control on Wednesday, yesterday, 18th of March, announced that at least 8 people have now tested positive to COVID-19, and 7 of them remain in isolation and at the mainland hospital, Lagos. The Health Minister, Osage Hanire, also disclosed that one of the index cases in Ekiti, while the remaining 4 are in Lagos. He said the 5 of them are now being followed up by the public health officials supported by the Nigeria Center for Disease Control. Now, in responding to the outbreak and avoiding future outbreak, Nigeria has banned foreign countries from coming into the country. Some of them. Federal government yesterday announced restricting entry into the country for travelers from China, Italy, Iran, South Korea, Spain, Japan, France, Germany, United States of America, Norway, United Kingdom, the Netherlands, and Switzerland, saying the points of entry are currently at the highest risk of all. The NCDC via Twitter also confirmed that all 5 cases that we currently have that were discovered, that were announced yesterday, had a travel history to the UK and the US. So it's been reported that most of the overseas cases were acquired in the US, Iran, Italy, and the UK. This is according to health.gov.au as of 18th of March 2020. Let me welcome my doctor into the studio, Dr. Ajay Iben Adekpitan from Lagos State University Teaching Hospital. Dr. Ajay, good morning to you.
Good morning.
It's good to have you here.
Good morning, everyone.
It's good to have you here.
I'm glad to be here.
Let's start with, I know our destination is cervical cancer, but let's start, as a medical practitioner, let's start with coronavirus. What can you tell us about the recent measures being put in place by government? First, flights are being restricted from the highly infected countries. And secondly, Lagos State is shutting public schools. Even some northern states also have shut down their public schools as well. Kwara State shut down public schools in that state as well. And Lagos State coming back here is saying by next week, Monday, all public schools will be shut. Also, all public gatherings in excess of 50 people will also be restricted. What are your thoughts on this, medically speaking?
All right. I'm from LUTH, Lagos University Teaching Hospital.
Right.
I'm from Lagos State University Teaching Hospital.
All right.
Okay. These are preventive measures. As we all know, the COVID-19 of the family of the coronavirus is a viral infection. You know?
Right.
And basically, in its prevention, it's personal hygiene, the washing of the hands, constant washing of the hands, repeated washing of the hands, and using an alcohol-based gel. With that, it's the spread is you could curtail the spread when you avoid crowded places.
Right.
You know, and Nigerians, Africans, being community people, you know, we like staying around each other.
Oh, so yes, we do.
The first and the basic thing we need to do is to avoid crowded places. So government coming down now with the policy to shut down schools to prevent large gatherings is a way to control the virus.
A lot of people say that the Lagos State government's directive, I mean, I had the discussion this morning as to, you know, whether churches to be allowed to take this measure at their discretion rather than ask them to restrict their gathering to 50. What is your thought on that?
That is, you know, religion in Nigeria, issues of religion and faith practice is very controversial.
It is, highly.
And it's a difficult region to delve into. But if we understand that it's for the good of all, and we understand that, I mean, we should take these steps. They are interim steps, short period steps to prevent further spread of this. Then I would leave this to church leaders and church heads, you know, to take a rational decision in the interest of the congregation they want to gather.
Right.
There's no point having to gathering people praying in the name of God, and if there's someone within the congregation who's carrying the virus, you know, there's a potential to spread this virus to other members of the congregation.
True.
So if for three Sundays or 4 Sundays, I mean, we can worship at home and do your worship, your relationship with God, and then we can gather together later, then it's fine. There are churches who do online services.
Right.
So you can go online, join them online, join your pastor online, do your worship online, and you'll be fine. We just want a period where people would self-quarantine, stay, avoid crowded places so that we could control this. We know that there's no treatment for now for this, you know, but death occurs from a complication of this illness.
Right.
So the way to go is to it's prevention.
Right.
Prevention. And if that is a way with which we're going to prevent the spread of this disease, then it's okay by me.
Dr. Ajay, this particular disease, COVID-19, is treatable. A lot of people have recovered from it. Yes, deaths have occurred as well. The recent one being in Nigeria here, the 5 of them that came into this country. We know that this thing can hibernate in the body for about 14 days, which means that these individuals must have gone into the society already. Looking at all of these things, what would you say is the picture that we should vividly be seeing right now?
The truth is, I've always had a problem with the single-digit numbers.
Right.
The federal ministry has said that there are the total number of persons that are exposed in Nigeria. I mean, that is not true. Because even with the Ekiti case that we heard about yesterday, he came in, he's been in Nigeria from the 3rd, flew in from the Murtala Mohammed airport, you know, and he was in a flight with some people, some passengers. He touched down in the international airport, drove from there to Ibadan. He was in Ibadan for 2 weeks. So who are those who he was with? And this was from the 3rd. He was in Ibadan for 2 weeks.
Right.
Then he moved from Ibadan to Ekiti. Now, we know that the incubation period for this virus is about 14 days.
Right.
Now, from that 14 days, he would have been shedding these viral molecules to people who are around him. So the figures for me, to me, are a little more conservative, whatever the reasons are from government. But
what could be the reason, though? Shouldn't the government be very factual and so that people can know how to protect themselves? What could be the reason?
It's two ways. Government may not want a situation whereby the height in the figures could cause a panic. We're very sensitive people in Nigeria.
Right.
So if they released the true figures, there might be some degree of panic and things.
Right.
Even when we had the news of the COVID-19, coming down to our shores, hand sanitizers skyrocketed, face masks were no longer available because people bought these things in excess of what was needed.
Right.
So that could be a reason why government would have wanted to sort of like
hold back on the numbers.
But in the real sense, people should know what they are faced with so that objectivity can come in the course of their prevention.
Let's talk about availability of medical personnel in tackling this. Do you think we have enough right now? Already, there's been some kind of probability as regards the number of doctors to a number of patients in Nigeria. Every day, doctors are leaving this country. Now we have this on our hands. Are we ready for this?
No, we're not ready for it. I can tell you this, we're not ready for this. Even without the epidemic, right? Even without the COVID-19,
right?
We are starved of doctors. Now with that epidemic, that's why I'm afraid, that's why I'm scared, with this epidemic, and if the spread goes on, unabated, uncontrolled, then our facilities are going to be overstretched, personnel are going to be overstretched, and going to have real issues in our hands.
Is it time to start recruiting doctors? Because Dr. Ajay, I understand that, it's not that we don't have doctors. We do still have doctors that are not in public service. There are doctors in private service everywhere. Is it time to start recruiting into the public service, medical practitioners?
Doctors in public service are not sufficient to cover the number of patients that they see. So if doctors who are graduating from med school, who finish their services, should be recruited into government services, then those who are into private practice, of course, should be included into government services. Because the burden of this disease is enormous, as you've seen in other countries. Facilities are being stretched in other countries, who we can even say that they have workforce and facilities, to manage this kind of health crisis. But of course, in Nigeria, we don't have it.
Dr. Ajay, there is this importance that I have attached to nomenclature when we talk about issues like this. And I've seen people brandishing some names. Coronavirus is a killer virus. Is it a killer virus?
It's not a killer virus. I'm grateful to God that it's not like Ebola. Ebola is a hemorrhagic virus. This is not a killer virus. Now, what makes it so makes the mortality so high is if the patient who has this virus has an underlying medical condition, an immunosuppressive state, and from data that we received, the mortality are associated with people in the 8th decade and the 9th decade of life. Those who are above 70 have a higher mortality. As you go down, you discover that the mortality actually reduces. In Italy and in Europe, where you have more elderly people,
older people
in their community. Now you discover that virus seems to have a high effect on them because you expect that their immunity is not top notch. But as you go down in age, you discover that the mortality and the morbidity associated with this virus actually reduces. So it's not a killer virus. Simple prevention: wash your hands regularly. If you have an alcohol-based gel, reduce contact with someone who has cold symptoms of common cold. Reduce crowded places, and try to maintain basic clean hygiene. It's going to do it.
If you have common cold, is it advisable to tell the person to stay at home and not go to work?
That is it because the virus has an affinity for the respiratory airways. You know, that's where it comes. So it can present with common cold, low-grade fever, coryza, what we call catarrh. What is good for us is to ask the person to stay at home, observe the 2 weeks, you know, and stay at home. When you're fine, you get back to work.
Indeed. Let's get close very quickly now before we get on to our next conversation on cervical cancer. Let's get some calls in. If you've got questions for my doctor, feel free to call Dr. Ajay on this in the studio right now. The number is 0700 993 993 993. That's the line we're working with. That is 0700 993 993 993. And we're taking updates from coronavirus incidents that we've got here in Nigeria. When you call, there is a lady that will pick your call just to get your details. Please be patient with her, okay? Be patient with her. Just give her all the information that she needs so we can have you here in the studio. Daniel is calling in from Aja. Hi, Daniel. Good morning to you.
Yeah, good morning.
Good morning.
Yeah.
Go on, Daniel.
Wait for the program. What is going on now?
Go on, Daniel. Go on.
Yeah, you talk about the LMC for postponing the late.
No. We did not talk about that, Daniel. You probably wanted to respond to the sports show. The sports show has ended, okay? Well, Daniel, thank you for trying. We really do appreciate that, okay? Let's move on to our next call. Hello, good morning to you.
Hello, good morning.
Good morning.
Yeah, my name is Jabin from Banana.
Good to have you, Jabin.
Yeah. I hope the situation we are now, people should be advised
Okay.
that they should not go for self-medication because these cases that they just discover now, they have joined the society. And so people will be ignorantly go to the pharmacy, to the dentist,
Right.
medicine, give me malaria medicine.
Right. Jabin, I lost your call. Do try and call me back. Let's talk to Mark. Mark is in his solo. Hi, Mark.
Yes, good morning.
Let's talk, Mark. Let's
I
talk.
want to ask the doctor a question about coronavirus.
Okay.
Can someone without the symptoms mentioned be infected with coronavirus, and at that stage, can a person transmit this virus to another person?
Okay.
If contact occurs.
All right, Mark. Mark wants to know if someone can contract this virus without having those symptoms that you mentioned.
Now, the symptoms come at the later stage of the infection. It's not at the contact with the virus that you start manifesting the symptoms. It gives a period of time when the virus would attach itself to the receptors of the airway, multiply sufficiently, and the person begins to shed the virus around. Now, at the point in time when the person sheds the virus, then he begins to manifest the illness. The illness, the symptoms of the cold, the cough, the symptoms of upper respiratory tract infection.
Right.
That is when you start manifesting the disease, but it's not at the point of contact.
All right, then. Martins is calling us. Hi, Martins. Good morning to you.
Hi.
Welcome to the Morning Crossfire.
Thank you for this program.
Thank you, too.
So I have a couple of questions for the doctor.
Okay.
Number one, if you are having these symptoms, say you're having catarrh, for example, and the catarrh subsides, maybe you're having catarrh, you took precaution, the catarrh subsides.
Yeah.
Do you see, observe the 2 weeks, but when the catarrh subsides, it means that you don't have the virus?
Brilliant question. Brilliant question.
Question number two for you, doctor, is since it's a viral attack, does it mean that once you have it, you are immune, for a while? Then number three question, all these things we see on the internet about putting your head inside water, hot water, getting the hot water steam that we used to do in those days.
Steaming.
And then this news that chloroquine or hydrochloroquine can treat the infection. How true are these things? Those are my three questions.
All right, Martins. Thank you, doctor.
Now, common cold is common in our environment. So it's not everybody who has the cold, that is come down with the virus. Right. However, these are the questions you need to ask. Have you been to any of the high-risk areas? Have you been to UK, Europe,
US.
the US, or the Middle East? Have you been to such areas lately? That's number one. Have you been in contact with someone who has this travel histories? So this is how you know. If you've not been into these high-risk areas and you've not met anyone who's had this travel history, it's not likely that your common cold is the corona infection, the COVID-19 infection. However, for optimum safety, you should see your doctor, or go to the hospital, see your doctor, be evaluated, and let the decision whether you're clean or you're not clean come from a medical practitioner. That's number one. If after the infection, if you are immune, well, usually after a viral infection, the viral infection is self-limiting. It depends on the innate immunity of the person, if the person is immunosuppressed or not. So if the person is not immunosuppressed, we expect that the person will come out of this viral illness, just as we've had testimonies from even from the US, from Europe, of people who've gone through the illness and they're fine. So if you're not immunocompromised, you should come out of this illness.
Dr. Ajay, please hold that thought. Austin has been on the line, so we'll take his question, then we continue with the answers. Hello, Austin. Thank you for holding the line. Hi, Austin. Austin is gone. Okay, let's take all your answers now.
So, there have been home practices of having to nose steaming, putting head in water, for blocked nose and things. Those things could just help relieve symptoms. Symptoms of common cold. You help relieve the symptoms of the blocked nose and things. It would help, with common cold. It will help with common cold, but I think you should go to a hospital and see a doctor if you have such symptoms and if you've been in contact with someone who's been exposed and have similar practice history. It's not been documented that chloroquine or hydrochloroquine will do anything. Chloroquine is not the treatment for viral infection, and there's been no proof yet. So having to take chloroquine, it's not going to help.
You know what, Lagos? Let's go on a break. This is the reason why we're here in Nigeria Info, to make sure that we bring the experts in to answer all the questions. Okay, we'll delve into cervical cancer later on the show, but a lot of calls are still on the line, so I'll have Dr. Ajay still weigh in on the issue of coronavirus and take all your questions. But then we need to head out now to a short break. We're right back after this short one.
More news and information coming up. We'll be back in a moment.
Big enough to have that. 7:58 from our studios here. We are live on YouTube. 99.3 is what you can search for on all of those platforms. That's Nigeria Info 99.3. Yvonne Ohaifo will be taking us through the headlines in less than 2 minutes. In the meantime, I think it's only proper to take in just one call before the news. So call before the news, and please, the caller that I'm about to pick, 1 minute. That means 60 seconds, only and only. Hello, good morning to you.
Hello, good morning, sir.
Good morning.
This is Mr. Ordinary. I'm calling from Amward of it.
All right.
I actually want to contribute in respect of the coronavirus.
Yes, please.
You see, I don't think, from the look of things, I don't think the Nigerian Medicare is ready, except Lagos State. If what happened in Enugu is anything to go by, people will certainly engage in self-medication, and that will contribute to the scourge. So that's my point. Thank you.
Thank you for talking to us. We appreciate that a lot. Let's prepare to head into the newsroom right now to bring you headline news. When we return, we'll take more thoughts on coronavirus, your questions, your thoughts, basically. While we have Dr. Ajay here, and when we're done with that, maybe we should just allot like 10 minutes more after the news, that is. After the news, we'll take 10 minutes to discuss coronavirus and take all your questions. Any question you've got concerning coronavirus, please send them in. We are live on all across socials. I can see a message from Yusuf Akinwale on Facebook. I'll take all of those messages when we return after this break. From the world as regards coronavirus. Stay here. It's a morning crossfire on 99.3 Nigeria Info.
Did you know that the morning crossfire now starts at 5 a.m.? Your favorite current affairs show on the radio.
Good morning, everyone.
Morning crossfire now starts at 5 a.m. The Chit Chat, Dailies Today, Sports Drive, and the Crossfire are all packed together in a 4-hour-long morning crossfire show Monday through Friday. It's engaging, highly conversational, and impactful. The Morning Crossfire on 99.3 Nigeria Info. Let's talk.
Nigeria Info, the nation's number one for news, talk and sports radio. I'm Sheriff Quadry. We're live on Facebook and YouTube. Nigeria Info 99.3. Just go, take us anywhere, watch us as you go in those cabs and everything. And you can drop your comments there because I'll be taking your comments on Facebook and, of course, YouTube. Yes, WhatsApp line is also very up and active. The WhatsApp line is 0809 597 5805. That is 0809 597 5805. On WhatsApp. Also, I should tell you very clearly that we also be taking thoughts via our Twitter feed. The Twitter handle is at Nigeria Info FM on Twitter. That is at Nigeria Info FM. Let me tell you about the statistics that we have so far. At least as of yesterday, China has about 80,894 cases of coronavirus with 3,237 deaths. United Kingdom, 2,626 cases, 104 deaths. United States, 7,324 cases with 115 deaths. Iran, 17,361 cases with 1,135 deaths. In Italy, 35,713 cases with 2,978 deaths. In South Korea, they've got 8,413 cases with 84 deaths. In Spain, 13,716 cases with 558 deaths. Japan, 1,614 cases with 36 deaths. France, 9,134 cases with 264 deaths. In Germany, they've got 9,367 cases with 29 deaths. In Norway, 1,470 cases with 3 deaths. Switzerland, 2,772 cases with 21 deaths. And the Netherlands, 2,051 cases with 58 deaths. On Tuesday, March 17th, the federal government, through the NCDC via Twitter, encouraged Nigerians to limit travels to these countries with ongoing transmission of COVID-19, as all the confirmed cases of COVID-19 so far in Nigeria have been imported. Well, let's take you to what the federal government said about restriction. Have a listen to this soundbite.
Federal government of Nigeria is restricting entry into the country for travelers from the following 13 nations: China, Italy, Iran, South Korea, Spain, Japan, France, Germany, Norway, the United States of America, the United Kingdom, Netherlands, and Switzerland. These are all countries with over 1,000 cases domestically. All persons arriving in Nigeria who might have visited these countries 15 days prior to such arrival will be subjected to supervised self-isolation and testing for 14 days. The federal government is temporarily suspending the issuance of all visas on arrival. The government is also counseling all Nigerians to cancel or postpone all non-essential travels to these countries. The government urges public health authorities of countries with high burden to conduct diligent departure screening of passengers and also endorses travel advisories to their nationals to postpone travels to Nigeria. And fourthly, these restrictions will come into effect from Saturday, 21st of March 2020, and it will last for the following 4 weeks, subject to review as the situation unfolds.
Dr. Osagi Hanire is speaking there on behalf of the federal government. I beg your pardon, Boss Mustafa, please, I beg your pardon on that one. I still have in the studio Dr. Ajay. He's talking to me about cervical cancer much later on the show. But for now, let's take a few of your thoughts before we move away from coronavirus. Yusuf Akinwale says the countries with better health system have their citizens affected. I hope the measures put in place can help curb this pandemic. We don't have the means to manage an outbreak. That's what Yusuf is saying on WhatsApp. On Facebook, I beg your pardon. But on the calls, we'll be taking your calls. I think I should take like 2 more calls before we go into other discussions this morning. Yeah, maybe we should take 2 more calls. But in the meantime, I've got comments on Twitter. So let's do a few Twitter comments. Laurie Berry on Twitter says, "Good morning, Sheriff. There is a ban on public gatherings greater than 50. Schools are shut. How do we manage the crowded bus stops and those long downfall buses? But I have over 50 people. Doctor, this is a real concern.
Yeah.
How do we manage this? Because I don't know. I'm pushing it to you.
Well, we would have to ask and plead with the government of Lagos State, to look into the transport system in this period, because the buses are really crowded. The red buses are crowded. The blue buses are crowded. You only need to see people standing by the walkway, standing by the door.
Right.
While trying to get to work. Right. And we'll just plead with the government of Lagos State, if they can have some form of screening at the bus stops before you register and pay for your ticket, be screened, have your temperatures checked, basically, and persons who don't have the common cold symptoms, should not be allowed to take the bus. That is what I could say at the top of my head right now.
Right. Hi, Chidi. Good morning to you.
Hi, good morning, Sheriff.
Good morning.
I've been trying to call earlier, but I haven't been able to get through.
It's good to have you.
Thankfully, I'm here to talk about it. My main worry is... Hi, Dr. Ajay. Good morning.
Hi, morning.
My main worry is about the lack of preparedness of the government in terms of the personnel on ground. How do we walk around this, seeing that we have a paucity of not only medical doctors, but nurses and almost everywhere in the health sector? And, it really has one worried about how we can actually manage this if there is a full outbreak.
Right.
That's my question.
It's a major concern, Dr. Ajay.
It's a concern. I'm worried about the personnel, facilities, personnel, if we have a full outbreak.
Right.
Our hospitals are not as equipped. Our doctors are short. We have short staff doctors, our nurses, other colleagues who are in the medical practice.
Right.
So we don't have sufficient. And that's the message we are preaching this morning of prevention.
Right.
Let's try as much as possible to prevent an outbreak. If I take it upon myself and my family to prevent an outbreak, and you take it upon yourself and your family not to be part of those who would encourage a spread, then I think together we can do it, because relying on our health facilities is not the way to go. I'm sorry to say that.
Indeed. Alhaji Bashir is joining us. Hello, Alhaji Bashir. Good morning to you.
Hello, good morning.
Good morning to you.
Fine. How are you?
We're doing well. We're doing okay.
Yeah. May God bring to an end this pandemic. Please, I want to make an appeal. Hello?
We're with you, Alhaji Bashir. Go on, please.
I want
Go
to make an appeal the federal government as well as to all the citizens of the country.
Right.
This issue of standing inside the branded buses, yellow buses, market, I think BRT and other vehicles should be regulated as well.
Okay.
We should not fully rely on government, as I said yesterday. We should be able to take care of ourselves as well.
Right.
Thank you very much.
Thank you, Alhaji Bashir, for talking to me. Dr. Ajay, we need to wrap up on this coronavirus conversation right now. But before we do that, let me just breeze through the messages that have coming already on Twitter and on WhatsApp. Alabi Michael says, what measures are being taken by government to sanitize public infrastructure like the mass transit, ATM machines, pedestrian bridges, and nobody is even talking about the ATM machines, pedestrian bridges and facilities that the general public come in contact with daily. And he ends it with hashtag COVID-19, hashtag Morning Crossfire. Please always hashtag Morning Crossfire in your messages. Yemi Sholedolu, that's at Ogayemi23 on Twitter, says, will gathering more than 50 affect General Hospital? That's another valid question. I mean, where do we go from there?
We're talking about the stretch and the stress on our facility if we have an outbreak.
Yeah.
And that's what we should not allow to happen. So the approach for me, just as the allergy has said and I had said before, let's make this a personal decision to keep our hygiene.
Right.
Wash your hands as often as you can and use an alcohol-based gel to clean as often as you can. And if for any reason you're developing symptoms of cold, please go to a hospital. We must not allow an outbreak.
Indeed. I agree with you, Dr. Ajay. Joy Forever says coronavirus cases in Nigeria may be more than we envisaged. I hope it will not spread. Do we ban markets, bus stops? Joy Forever, thank you for sending that in. Patricia Raymond at Patricia 3190269 says, why do we keep letting people in only to reactively start pursuing this virus? We should hold everyone coming in at the point of entry. We can't afford an outbreak. Please, hashtag Morning Crossfire. Thank you, Patricia. At Peter Zero on Twitter says, good morning, Sheriff. Nice one so far, but I think that the hashtag follow Lagos as Lagos State government should try to notify the public on areas the index cases of the COVID-19 Nigeria have visited, so people in such areas can also be aware of the risk and be tested. At IM_Mr. Clever says, please help me ask the doctor, aside touching or being exposed to a coronavirus infected person, does the circulation of cash also contributes to the spread of the virus?
Well, yes. Anything that would, if an index case has a contact with this,
right,
and somebody picks it up,
it's
it's a possibility, but you can never say never,
right?
So the message is still be careful.
Observe your personal hygiene very seriously. At almost F Bush, that's Ololade. And this person says, good morning, Sheriff and Doctor. Please, what's the best advice for people who ply public buses and exchange bills every day? We have to go to work, and I'm personally worried. Can be leaving my change to conductors now?
No, please don't leave your change to a conductor. Get a hand sanitizer and wash your hands as often as you can.
Yep.
I mean, when you received a bill, a Naira bill, try and wash your hands.
Right.
If you received any other currency, try and get, there's this small volume sanitizers, hand sanitizers that we can go around with
the small bottles.
The small bottles.
You can just drop it in your pocket or in your purse.
And use as often as you can.
Indeed. Olariwaju Odetola that's at Odetola Paul says, how do we start to get tested since people abroad are tested positive? We need COVID-19 test station. Do we have, to your knowledge, Doctor? I'm sure that the government have a way of testing people, but we can't. Do you have any public sites that are test stations for COVID-19?
The information is is on the
NCDC website.
And it's NCDC website, where you can go for a testing. But before you go, before you even look for such site, is to see your doctor. Let your doctor evaluate you.
Exactly.
Right.
Exactly.
Be evaluated so that you don't raise panic. You don't cause a panic when you. If you tell me that you're going for a COVID-19, I will ask you. Have you been exposed? What's been your history in the past 10 days?
Right. Right.
But what I would say is that you get to see your doctor. Let him evaluate you, and he will tell you the necessary step to take.
Indeed.
For all you care, it might just be a common cold.
It might just be a common cold, Doctor. Well, let's leave this conversation right now and head on to our next conversation. This one, don't worry. This is Nigeria Info. We do not stop talking. Conversation on coronavirus most especially continues. As a matter of fact, if you are not following us online, maybe it's high time you started doing that, because there are updates almost every time on our website, on all our socials. Website is nigeriainfo.fm. Visit it. You get the latest gist on our website. If you're not following us on Twitter, please do at Nigeria Info FM on Twitter. You get all the news, all the breaking news there. If you're not on Facebook with us, please do Nigeria Info 99.3 on Instagram. We're very active there. Nigeria Info FM Lagos. Go to these platforms, follow us, like our page, subscribe to our channel. and you rest assured, because we don't just concoct up stories. We make sure that we get stories for you from the relevant authorities. We don't make up anything. That's why you can trust us with the authentic information for you. Well, this morning, let's get on with our conversation, shall we? Cervical cancer in Nigeria. Well, cervical cancer is reported to be the second leading cause of cancer mortality in Nigeria. This is according to the World Health Organization back in 2019. As of June 2019, estimated by HIV Information Center and cancer on Nigeria's human papillomavirus and related cancers, Fact Sheet 2018 indicates that every year, 14,943 women are diagnosed with cervical cancer and 10,403 die from this disease. Dr. Ajay is here. Dr. Ajay, this is scary.
Yes, it is. It is. And that's where my passion really lies. Fortunately, cervical cancer is one of the cancers which you can control because it has an infective agent, the human papillomavirus 16 and 18 mainly. But there are other strains from 6 to 11 to 13 to 31, 33 to 49, 51, 54. There are several strains.
These are strains of papillomavirus.
These are strains of the human papillomavirus. But the ones that are troublesome for cervical cancer is 16 and 18. Anal cancer too is also associated with this human papillomavirus. Vaginal cancer is also as a vulvar cancer. So it's a virus that has a predilection for the genital areas. And how do you get infected? You're infected when you have unprotected sex with a carrier. Someone who's a carrier, a lady or a person gets exposed to that person, the person is infected.
Can a man carry the human papillomavirus?
Yes, obviously a man will have to carry it, to introduce it to
the opposite sex, or anybody
to introduce it to the opposite sex, or those who are, those who have alternate styles, and no receptive. You can introduce it, So that is the main way with which is transferred by the social behavior. Now, ask me. If we can curtail that social behavior, then we'll have a downturn.
Yes, there will be a drop. Definitely.
There'll be a drop in the incidence. There'll be a drop in the mortality. That's number one. Two, if people are aware, like this platform who we're having, and we're talking to about 20 million Nigerians in Lagos and beyond, they know that they can have vaccines. The vaccines are available for the male and for the female.
I've heard that vaccines are short in supply.
They are short in supply. Everything is short in supply, unfortunately, in Nigeria. Sadly so. But they are available. They may be expensive, marginally expensive. That is relative to. But they are available. Now, the testing is also available. You could go and have a human DNA test to know if you're positive or you're negative. Now, if for any reason you're positive, then you now begin to watch out.
Let's track back. We'll go to testing, but let's track back to the vaccine. Who can take the vaccine? At what age?
Now, a man can take the vaccine, a woman can take the vaccine.
Okay.
For the ladies, children between 9 and 16 can have the vaccine.
All right.
It's advised before they get active, should have the vaccine. Now, you could extend to 23, 20, 26, to have a vaccine. However, you can't ask a woman sexually active what she still need a vaccine.
Exactly.
Now, you need to do a DNA testing.
Okay.
Human papilloma. If she does a DNA testing for the human papilloma, she will have vaccine. If she's positive, she needs now monitor, observe, and watch. Because the incubation period for this over 13 years.
Okay.
From the first contact.
Right.
But usually because of the, maybe use the word loose now, and some category people who are 9 months and people engage in that because of the early exposure they have. Now it tends to come with disease in the fourth or decade of life.
Right.
But so answering your question, men could have cervix. Cervix is that they could have between 9 and 16, and we could mark up to 23, 25. The male child too could have a vaccine that is called the Gardasil.
Okay.
Could benefit from the Gardasil.
The male child.
Yeah, the male child.
A young boy. Can get vaccinated.
Can get vaccinated
for human papilloma virus.
Yes, he can get papilloma virus. So that he would. Remember, I told you that penile cancer that affects the male penile organ.
Right.
Is caused by the human virus.
Oh. You mentioned that earlier.
Anal cancer, the cancer that affects the anus, is caused by the human papilloma virus. So, and we know that, I mean, usually men are engaged in receptive sex or an alternative lifestyle.
Right.
So men could get vaccinated also to reduce the burden of this disease.
Let's talk about that burden. Okay, before we go to burden, let's talk about testing that you mentioned. You said that people can get tested through testing and everything. It's the only way that you're a carrier of human virus?
Obviously, that's the only way to know.
In breast cancer, you could self-examine. You can know whether there is lump, then you get tested and everything.
You know, that's for the breast. Breast cancer would normally present with a lump on the breast tissue.
Right.
The outer upper quadrant of the breast tissue, if you divide the breast into 4 quadrants.
Right.
Or in the armpit, then you could know. At that age, at that stage of detecting it,
right,
the breast has already been affected. So, but for the cervical cancer, the way to know is through the DNA testing.
Right.
By the time the lady has symptoms, postcoital bleeding after having sexual exposure, or even for a postmenopausal one down with bleeding or foul-smelling discharge, the person at least has already at least a stage 1B2 cancer. So we're not talking about detection at that level.
Right.
So in from the detection from the DNA testing, there are risk factors that dispose women to having this cancer.
Tell us about this, right, doctor.
Let's look at it from and climb the ladder up.
Yes, please.
Early sexual exposure.
All right.
A teenager who's violated neighbor or someone or relation and has been early in life and been in that risk factor.
Okay.
Right. Now, and we have issues, low socioeconomic factors. This will drive people to have to find a way to provide what that means.
Right.
In that through those who are engaged in sex workers and stuff. Then with this is the infection with the HPV virus.
Okay.
Which comes to the thing. Now, alcohol, smoking, none of the risk factors associated with this. But mainly is this in the HPV.
Right.
So if you could to a partner and you could assure that your partner to a partner. So sometimes you could be faithful as a partner who's unfaithful. The partner has who has other partners. It's a chain, it's a web. So eventually gets this next person, even though she tells you that she's faithful, the partner who has not been. No, it's them too. So if this risk factor curtail, we try to control this factor in a way preventing aside from the DNA testing.
Indeed. Doctor, quickly look at the burden. You mentioned it in panel. I was going to go there. Let's go there now. Tell us about that because listen, I won't lie to you. Even for Nigerians to afford paracetamol, some people it can be really, really tedious. And our health system is not that structured in such a way that people will stop spending out of pocket to access medical care. What is the cost of treatment when we talk about cervical cancer?
The cost of treatment for someone who's come down with cervical cancer, putting it lightly in the current day Nigerian situation, right? Because let's scenario is this lady who's come down to a stage 1 or stage 2, cervical cancer. She's a tertiary institution.
Right.
She sees doctor, maybe a general hospital, for example. It's 1,000, 5,000 to see a doctor. She runs some basic investigations, and we cap those investigations at 110, 120, because she's going to do some CT, some chest X-ray. They're going to have to take a sample from the cervix, to do a biopsy to confirm the diagnosis.
Right.
Then she starts treatment. Starting treatment will mean her having to take in chemo and radiotherapy. And the cost of these things are expensive. So one way, the burden is heavy. The burden is heavy. So the figures that you quoted, the 14,943 and of those who come with disease and those who die from disease,
about 10,000.
About 10,000.
Right.
The reason why the mortality is that high is the financial cost of treatment.
Oh my!
The financial cost of treatment is heavy. Now you just said that there are people who cannot afford. That's the worst case. Who cannot afford?
Right.
Now you now imagine someone who's going to have to pay as much for radiotherapy, pay as much for chemotherapy, pay as much for the professional who's going to handle them.
Right.
And sometimes pay as much for surgery. Now, one other thing that makes the burden that high is because people present late. Late presentation is a big problem.
Is it for lack of awareness or what could be the reason?
It's interwoven because of the poor financial status of the person.
Right.
When you begin to see symptoms, it's not normal for a woman, for example, to have foul-smelling vaginal discharge, either watery or bloody. When he sees the symptom, this person who we're talking about, the illustration, doesn't have a job yet. So the only place the person can run to is a religious house, the church, or the mosque, and they start prayers. They begin to pray, maybe do some payments, some offering, for prayers and stuff like that. But the disease is progressing, is advancing.
Indeed.
Now, by the time she begins to realize and people begin to tell her that, look, this your prayer thing is not working. Come and go to the hospital. She's lost time. She's lost money. And, at that stage, there's nothing the doctors can do because it's advanced.
Right.
So we just manage palliatively. That's number one. Number two, the low level of awareness. I can tell you that a lot of people are still not aware of this disease. They said it's the deaths from the body to come out. And you can imagine when the first symptom already should tell you that there's some problem within your system.
Right.
And 3 years down the line, you're trying to manage the symptoms with some agbo or some kind of local medications.
Right.
And the disease is advancing. By the time you come to a hospital and you see a specialist, the disease is advanced.
Right.
It's complicated. Some other organs have been affected. There's nothing you can do really
indeed.
than just to manage palliatively.
Dr. Ajay, let's head out to a break. When we return, we'll talk more about the availability of medical facilities to take care of the burden of cervical cancer in Nigeria. It's important that we touch on all of these areas. In case you are just joining us, it is the Morning Crossfire. I have Dr. Ajay Eben Adekbi, senior specialist resident in oncology at University of Technical. He joined us this morning coronavirus, and then we are on his own constituency and specifically we are talking cervical cancer. I am Sheriff Quadry. We'll be back after this short timeout.
Back in a moment. We're back. We're back on 99.3 Nigeria
Did you know the Morning Crossfire now 5 a.m.? Your favorite current affairs show on the radio.
Good morning, everyone.
Morning Crossfire now starts at 5 a.m. The Chit Chat, Dailies Today, Sports Drive, and the Crossfire are all packed together in a 4-hour-long morning fire show Monday through Friday. It's engaging, highly conversational, and impactful. The Morning Crossfire on 99.3 Nigeria Info. Let's talk.
99.3 for Morning Crossfire with Sheriff Quadry. I am back with you. Dr. Eben Ajay Adekbi is here in the studio, an oncologist with Lagos University Technical. Lagos, let's okay. Open up the phone lines if the question for the really talking, okay. Let's do on any question you go as regards cervical cancer. Cervical cancer, okay. Let's get that. Cervical cancer. Any question you have got, and I expect more ladies to call for anything that they need. The number is 0993 993 993. That is 0700 993 993 993. You can also tweet me at Nigeria Info FM on Twitter. That is at Nigeria Info FM, or send your thoughts in via our live stream on Facebook and YouTube. We're there live. You can see Dr. Ajay in the studio on Facebook and YouTube. Just search for Nigeria Info 90.3. That is Nigeria Info 90.3. Don't send your thoughts in via WhatsApp. For now, the WhatsApp line is down, okay? Please Twitter, the live video streams that we have on YouTube and Facebook. Of course, the phone lines with us on the show this morning. We've got Chidi on the line. Good morning to you.
Hi, good morning, Sheriff.
Good morning.
I called earlier in the earlier section, but
right.
you were talking about cervical cancer. I wanted to weigh in.
Yes, please.
So there's a general perception that cancer is death sentence, and most people reach very even those early stages. So can you just not a bit have done for someone who's in an early stage of several cancers?
All right. Thank you.
All right, thank you very much, Chief, for having to call back. Qualities of treatment.
Right.
And I tell you that cancer can be cured if the presently. If recently, it can be cured. Not a death sentence, really. You could, first thing to be done is surgery. You could do surgery for those who are amenable for surgery.
Okay.
Right?
Okay.
So just remove the lump. If it's a breast lump, there's a suspicious lump that you've done. You've evaluated it, sonogram, and doctors need to pick a needle, the tissue, and you could do surgery. A local lesion.
Right.
All right. Or a local excision, called the local excision, the technical term, means that you remove that lump from that place.
Right.
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 Then you subject the person does chemo and or radio. And the person, depending on the character of the tissue that has been removed, the person could also some hormonal tablets, some hormonal medications, so that the person could have a full treatment cover. Not a death sentence. The cases where we might are those cases that are not admitted to any form of treatment. It's gone on for a while. The person did for a while. Some organs have been affected and teared in the course of the disease, and it now becomes systemic. There's nothing you can do about that. But when the disease comes in an early stage, surgery on, then radiotherapy can be done. That is a beam of electric wave on that lesion to dry it up, and then chemotherapy can be given, for just to mop up any other nodes or parts of the body that may have had a little of these seeds in it.
Right.
So it's not a death sentence if the person presents early.
Gabriel, good morning to you. Hi, Gabriel. Are you there? Gabriel's gone more there. Let's see who we have here. Hello, good morning to you.
Hello, good morning.
Good morning.
This is Yetunde from Malaba.
Welcome here today. Talk to us.
Actually, I've had this lump in my breast like 2007. So I had an operation then.
Yesterday, before we go on, right, let's turn off your radio so the doctor can hear you clearly.
Okay.
Turn off your radio.
Okay. I've done that.
Okay, go on.
So then, when it was tested, it was not cancerous. So now, he said some of the symptoms, like for cervical cancer, because I went to Badagry General Hospital one time. So I was asked to go to somewhere at Oyinbo Market Street for some tests, because I just wanted to run some tests on that. So, but I didn't meet the lady there. So since then, I've been very busy and school and all that. So listening to this now, is this just the smelly menstruation, or is there any other symptoms?
Sorry, Yetunde, sorry, how old are you?
I'm 32 now.
32. How old were you in 2007?
I think I was around 18 or 19, thereabouts.
Okay, all right. It's not unusual to have teenagers or those who are in their early 20s to have lumps.
You can hang up now. Let the doctor explain, okay?
Okay.
All right, then.
Right. So it's not unusual to have lumps. A woman will have lumps in her breast. And usually these are associated with her periods.
Okay.
Whatever time in the period she could have it. Then that's number one. Number two, there are some lumps that are just, we call them benign lumps. They are just there as part of your body physiology.
Right.
So you could have it tested, just as she said she had hers tested, and it was negative. Right. There were no malignant cells there.
Right.
Now, the other thing is, for some cancers, there's a family history, particularly for breast.
Okay.
If a lady has a mother, an aunt, or a cousin who's had a history of breast cancer, then she should be wary, not worry. She should be wary, and she should monitor herself, because she already has a history of a first degree relative that has a cancer.
Right.
So these are the things that are all put together, in evaluating. There are some, though, that are put together in evaluating a patient. Now, if she has the history of a discharge, now, it's not all foul-smelling discharges that are a prelude to cancer.
Okay.
No, it's not.
Okay.
The pelvic infections generally could...
Doctor, please hold that thought. Gabriel called earlier, but we couldn't hear Gabriel. But Gabriel is back on now. Gabriel, are you there?
Yeah.
Okay.
Yeah, I'm there. Good morning.
Very quickly, so that the doctor can conclude on his chain of thought.
My wife is a patient in that last hospital. It's ovarian cancer, but she's had been taking her chemo. We are coming there on Tuesday for the third dose. But he still has a swollen stomach. I don't know why.
Oh, Gabriel, thank you for your question. He would like to know why the wife still has a swollen stomach.
Yeah, except I see the patient and we have a long talk. Yeah. I don't know at what stage she started her chemo. Yeah. Right. I don't know at what stage she presented to the hospital. Right. I don't know what it's likely that she presented at a late stage. Right. 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 And it's also possible that she presents at an early stage. Cancers have different characteristics. For an ovarian CA, at a stage 1C, an early stage, let me not bother you with the terminologies. Yeah. At an early stage, she could have a big tummy. Water would have accumulated in that tummy at an early stage. Right. Now, this person is going for her third chemo. She should have at least 6, right? 6 chemos for her full treatment. She's going for the third. Right. So it's too early, in my opinion, to begin to worry. Right. Right. If after she had taken her full course of chemo and there seemed not to be a good treatment response, then we can now investigate why.
Let's quickly continue with. I think you've been clear enough. Let's quickly continue on the chain of thought that you were on about discharges, all discharges with foul smell.
It's not all discharges with foul smell that's a prelude to cancer. Right. Sometimes some gynecological conditions could cause a foul smelling discharge. Right. I mean, if you see your gynecologist and you'll be fully evaluated. Pelvic inflammatory diseases, what we call toilet disease, could present with foul-smelling discharge. So it's not all foul-smelling discharges that are, prelude to cancer.
But what should Yetunde do?
But Yetunde, we've talked about the risk factors. Right. So is there any of these risk factors that she's exposed to? Right. So I mean, if she's had partners and partners who have had partners, but what she should do is to see her gynecologist. Let her go and see a specialist and have herself evaluated. The specialist will tell her what to do and the treatment that she's going to have.
Let's talk to Oladipo. Hi, Oladipo. Good morning to you.
Good morning.
Good morning.
Good morning, doctor.
Morning, ma.
I quickly want to ask a question about this cervical cancer we are talking about.
Yes, please.
My take is, I have a case now. The person is bleeding consistently. At a time, the bleeding will stop. Even during sexual intercourse, sometimes you perceive some kind odor that you don't. So I don't know, what should the person do? Sometimes the bleeding will cease, and the person won't even see her period for a very long time. At the time when the thing will come back again, the thing will start pumping and rushing and something like that. And the person is having a big tummy. So what do we do?
Now, you could ask the person to know the color of the bleed.
Okay.
Is it frank blood, frank red blood, or is altered, rusty colored blood? That's a pointer. Then if it occurs immediately after coital activity, then I would say the risk factors.
That's sexual intercourse.
Sexual intercourse. Okay.
Yes,
Sorry.
yes.
Let's put it the way it is. Sexual
Yes.
Sexual intercourse.
Yeah.
Then you look at, are there other symptoms that she's having? The classical symptom is irregular vaginal bleeding with a mild odorous discharge. That's how they will tell you. Okay. Either the discharge is watery and smelling, or bloody and smelling. If that is the case, then I think you should go and see your specialist.
All right. Audrey's here. Hi, Audrey.
Hello. Good morning.
Good morning.
Good morning, madam.
So I have a question.
Listening.
For those who are advocates for cervical cancer and who are really passionate about spreading the word, what would you recommend is the best way to really educate or to do awareness on cervical cancer? And I have a second question. What does it cost to do a screening in the public hospital? And thirdly, what does it really cost to see a gynecologist?
Audrey, is that all?
Yes, that'll be all.
Okay, all right. Thanks for calling.
So there are different mediums for an awareness. This is a medium. Then you can go to your local church or the local mosque, right, or a women program. Some weeks ago, I was with an old school women program in Maryland.
Right.
And it was an avenue for us to come together, and we still had this discussion. So there are different avenues. Make yourself available.
Yeah.
If you want to be a crusader, make yourself available. Meet whoever person that can give you an audience, and you have the floor, and be part of this crusade.
Right.
Now, she talked about the cost in the government hospital.
Yeah.
If you walk into Luth, for example, well, I wouldn't say it's completely free, but I know it's available. And I know there are other centers in town that do cancer screening,
right?
And you can get a vaccine for as cheap as 15,000-20,000 naira. And the vaccines are such that there are those who can have 2 schedules: the first time, 4 weeks later, and 6 monthly,
right.
And that will be the end of the vaccine. Then those who have the first time and 4 weeks later, that will be the end of the vaccine. So, I mean, give or take, you could have like 50K.
Right.
You could do the testing. You could do a vaccine, and the cervical cancer vaccine, and that will cover cost. Now, the cost of seeing a gynecologist.
Yes.
Please go to a government hospital.
Okay.
Government hospitals are usually cheaper than having to do them private. But however, if you can afford a private, you can't do a private.
Let's talk to Dr. Kemi. Dr. Kemi is calling from Luth. Hi, Dr. Kemi.
Good morning. Thank you very much.
Good morning.
Dr. J, thank you very much for the enlightening session this morning.
Thank you, ma'am.
I'd just like to chip in that cancer is not a death sentence. Cancer is not a death sentence. And I appreciate all the callers that have called in. But like Dr. J said, we don't want to see people that are already bleeding and having malodorous symptoms. No. We want to screen people. I am a female, and I just did my liquid-based cytology last week. Liquid-based cytology is an advancement on the pap smear, and it is only 10,000 naira. So people should please go out and get screened. Instead of spending all your money on Ashrebi, on one funeral after the other, one wedding after the other, do a simple test for yourself. The mammogram is probably 10,000 naira.
Right.
The liquid-based cytology I did last week is 10,000 naira.
Right.
And when you do it and you are clear, you don't need to do it in another 2 or 3 years.
Right.
So please, people should get screened early. People should get their vaccines. When the vaccine first came, I took it. It was 6,000 naira then. But now it's about 12,000 naira. Big deal. It's still not up to the cost of Ashrebi. So please, let's all get screened. Let's all get our vaccine.
Right.
Cancer is not a death sentence.
Right.
We see people that are 10-year survivors, 20-year survivors, and 30-year survivors because they came early. Thank you very much,
Dr. Kemi.
Dr.
Kemi, before you go, Dr. Kemi, are you with me?
Sorry?
Before you go, I'd like to ask you a question because you're calling from Luth, and I would really love to know: can anyone walk into Luth and ask to be tested? Can anybody walk into Luth and ask to be tested for cervical cancer? And what's the process like? What's the process like?
Well, the liquid-based cytology, it's a simple test where you walk into the lab. I did mine in the same lab in Luth. You walk into the lab, you fill the form, and then they take you into a room. Of course, put your legs like they put a speculum, something that looks like a cup, into your vagina so that you can see your cervix properly. And then they put a brush on the cervix to clean the cells on that cervix. So it's that brush that is taken to the lab to find out whether or not there are malignant cells on your cervix. So it's as simple as that. It's only 10,000 naira.
Dr. Kemi, thank you so much for calling in.
All right. Thank you very much.
Yeah.
Thank you, ma'am.
Yeah, Dr. Ajay, you'd like to say one or two words, but hold on. We have Wayo on the line. He's calling from, I think, Ejigbo. Hi, Wayo.
Yeah, this is Wayo from Ejigbo. Good morning once again.
Good morning.
Sorry, I want to ask the doctor if you have means of preventive measures, as in the list of some of those things that would prevent it occurring at the first time.
All right, Wayo. Preventive measures, he said.
Well, I would, if we look at preventive measures generally for cancers, avoid risky behavior, sexually, social behavior, limit alcohol, smoking. These are preventive measures. Then go for yearly checks. Go for yearly checks. Dr. Kemi, who just spoke, told us that she's had her liquid-based cytology done. It's a preventive measure, so she knows what her state is. Go for yearly checks. Then I would also add that let's eat healthy.
Okay.
Our diet is important.
Diet.
Yeah, diet. Diet is important. Let's eat healthy. Let's limit some of the things that we take normally. Let's do more fruits and vegetables.
Right. Right.
And let's live well.
Indeed. Ayodele Babatunde on Facebook says, please, doctor, is there a better way to create awareness to people who are yet to be aware of cancer?
There are several ways now. There's a social media platform is there.
Right.
The Facebook that you making a comment from is there. Then we've talked about the various religious organizations.
Right.
That have large crowd following.
Right.
You can make awareness from there too.
Indeed. Let's take more comments from our Facebook page. Oh my, plenty comments on the Facebook. But then again, let me just take this one. Then we head back to the phone lines. Okay. So this person is saying, good morning, Sheriff and Doctor in the house. My name is Good Luck. Concerning testing for cervical cancer, a simple cervical screening with acetic acid and a routine pap smear could help test for possible cervical cancer and HPV 16 and 18 infection. A pap smear test is highly recommended for sexually active females from age 25. Good Luck is your name. Good Luck. Dr. Ajay said all of those earlier on the show. We're wrapping up right now. We need to quickly wrap up. But before we do that, maybe, just maybe, we can squeeze in one call before we wrap off on the show this morning. Or Dr. Ajay, because of time, really because of time. Let me get your last word. We have 2 minutes left, so I wouldn't want to squeeze in one more call. What would be your call to action to everyone listening right now as regards cervical cancer?
My call to the average person: avoid the risk. Don't expose yourself unduly to uncontrolled sexual activity. Right. The first that's my first call. Right. The second call is, we've talked about the prevention, how you can be part of the crusade to prevent this cancer spread. Secondly, then spread the word. Tell somebody else about it, that this is not a death sentence. It's combatable. It's curable at the early stages.
Right.
Then I want to appeal to government. I know NHIS government is doing a lot for our cancer patients. We want to appeal to government to put a lot more drugs on the drug list for our cancer patients. That's number one.
Right.
Number two,
Right.
the health insurance program should be all-encompassing. The community health insurance should include the person on the street,
Right.
the person who cannot pay out of pocket for the medications. Let them be covered. Let them have a health insurance covering.
Right.
Then, this may be asking too much, but let it be on air that we're requesting that all our drugs be on NHIS list.
Right. Dr. Ajay, thank you so much for coming on Morning Crossfire. I have loads of messages for you on Twitter, but I can't take it. Dr. Ajay Iben Adikbito, senior specialist, resident in oncology, Lagos University Teaching Hospital, and he joined us this morning to discuss coronavirus and cervical cancer. Dr. Ajay, thank you for coming around.
Thank you for
having me. And we'll be seeing you more on Morning Crossfire on Nigeria Info.
It'll be a privilege.
Lagos, that's what we got for you this morning. Thank you to Zainab Ahmed, who assisted in the production. I'm Sheriff Quadry. You can follow me on Twitter, on Facebook, on YouTube, on Instagram at Sheriff Quadry. Let's do this again. 5 a.m. 5 a.m. Not 6. 5 a.m. Weekdays, Monday through Friday. Do have a good one. We're back with What's Up Lagos at top of the hour of 9.
More news and information coming up.